Welcome to the next session, which is the infection control and patient safety, where another important topic which is very essential in all the critical care units as well as in OTs and prolonged bedridden patients who will be on a catheter, which is the Cauti. So today in this session, we'll be seeing about what is Cauti and what are the major causes and what are the major symptoms and how it can be prevented, which is mainly by the use of Cauti bundle. So now we are going to focus on what is Cauti. Let's go into the introduction. So Cauti is nothing but it is the catheter associated urinary tract infection. In simple terms, we can call it as the infection which is mainly due to bacterial origin and which we call it as bacteriuria, bacteria in urine. And when the colony count is around more than 10 to the power 5 in the urine. So this we call it as bacteriuria in a catheterized patient, not more than 48 hours. So who can be the major risk factor? The major risk factor would be prolonged catheterization for more than 30 days and patients who are on a catheter material such as latex and who are having a very short urethra, which is female sex of origin, and highly prone to develop infections such as diabetes in old age people who are having poor immune status and patients who are not maintaining poor personal hygiene such as no perineal hygiene is being given after catheterization, debilitating diseases such as any autoimmune disorders and any failure of sepsis during catheterization, or if the renal impairment is going for severe dysfunction. These are the possible risk factors where a patient can develop COTI, which is catheter-associated urinary tract infection. Now we'll see about the pathogenesis of COTI, how this COTI is being developed and how it is going and reaching into the bladder. So there can be any of the aseptic protocol which is not followed during the insertion. So we can start in from that is not maintaining the closed drainage system from the Foley's to the tubings. So or else no proper catheter being fixed, or might be the tube is not maintained below the bladder level and not above the ground level, or might be bacterial interference such as frequent pricking from the tube in case of taking a sample, or in case of like removing the catheter and not when indicated, but just leaving the catheter in place may also play a major role for the colony count to increase. So these are the possible treatments, the causes which develops the COTI. So the possible causative factors would be bacterial origin, such as Inuniola, classified, unclassified, Anaerococcus corynebacterium, E. coli, Shigella, Gardnerella, Lactobacillus, Staphylococcus, Streptococcus, and so on. The common signs and symptoms of COTI would be urinary urgency, that is frequently going into the restroom and unable to control the bladder, such as urinary frequency. Patient is having difficulty in urination, that is difficult maturation, which we call as dysuria. And of course, when you take a temperature, the patient is going to have more than 38 degrees Celsius, and patient may complain of costovertebral angle pain, and in severe cases, they may also have severe tenderness around the flank region. So here the cotton bundle we can divide into core measures and the other one would be supplemental measures. So the core measures would be like what we do before insertion and supplemental measures is after insertion. So in core measures we focus on how the aseptic technique, how the sterile articles to be done, whether we have to delay the insertion or is there any other portal of like whether we can use female condom or male condom for a client or use a diaper or we are going to use intermediate catheterization, that is we are delaying the insertion of the catheter. And in case of a supplementary measure such as already the catheter in place, then what can be done? we can plan in for starting for antimicrobial catheters, electronic reminders whether to when to remove, nurse-based interventions, that is the care after the catheterization is in place. So after the catheterization is in place, the major things what we have to follow is that during or transportation, see how much the urine is being level into the urobag. It should be emptied when it is one-third full during transportations, and when the patient is on ambulation, that is trying to walk in and around the bed, see that it is around the lower to the waist level, proper securement of the catheters, as well as we have to see whether any prophylactic antibiotics the patient is getting on, and we have to also plan in for early removal of the catheter. So the strategies that are not recommended for Cauti prevention, such as we should not insert any other port or drain tubes or any other extra tubes into the closed drainage system, which may hinder into the sterility of the catheter. And changing the catheter or drainage bags at a routine or fixed intervals is not good frequently. And routine antimicrobial prophylaxis. So a patient can go and develop into antimicrobial resistance. That's the reason we should not force or purge so many antimicrobial drugs. And cleaning the periurethral area with antiseptics. Instead of using antiseptics, we can go in for soap and water, because these antiseptics may erode the skin or may cause the dryness of the skin, and patient can develop some other infection out of it. That's the reason frequent or high usage of antiseptics to be avoided. And irrigation of bladder also to be avoided unless it is indicated. Installation of antimicrobial solutions into the drainage bag is also bad, not recommended, because that may develop resistant flora of the patient, and it may create more worsening condition of the patient. And routine screening, that is just to prevent Cauti, you cannot go and routinely take samples from the patient for checking for bacteriuria if they are asymptomatic. So the Cauti bundle, like you can plan in for like four major uses, that is, it is used for enhancing the compliance of the evidence-based measures whereby improvised care can be given, as well as client will be having a better outcome, and clinician also can plan and for when the catheter can be removed, and it also helps in preventing hospital acquired infection. So the major principles over here is three major principles: A, B, C. A is that each element must be implemented collectively and to be adapted to the local setting. B is that healthcare providers are to be advised to follow each bundle element by all the members of the healthcare team member, even if it is a new staff or a new paramedic entering into that particular ward or ICU. And principle C is that develop and promote a positive habit forming behavior among the providers and ultimately a reliable care process. So to conclude, so you have to follow the insertion technique, such as insert the catheter only when it is indicated, follow strict aseptic technique throughout the procedure. There must be a closed drainage system throughout until it is removed. Appropriate size of the catheter to be used. It should not be too tight or too loose from the urethra. Proper securement after the catheter is placed might be onto the thigh or onto the patient's abdomen. And maintenance is that daily catheter care with soap and water or with normal saline. Catheter secure being properly at times. Drainage bag must be always above the floor, and it should be below the bladder level when the patient is walking. And closed drainage must be followed throughout the uh, hospital care. Daily assessment of readiness of the patient is to be documented. So to assess, we can follow these common questions. And that's all for today's session. Thank you.